rubyiruko ariko hari impamvu zigenda zibitera kuki urubyiruko ari rwo usanga ruri kwandura virusi itera sida kurusha yenda abakuze. Ahanini nuko urubyiruko baba bafite ubumenyi buke ku bijyanye na virusi itera sida kandi baba bafite no kwitinya kuba bajya kwaka serivisi, ugasanga ntabwo bajya gushaka serivisi zabafasha kwirinda virusi itera sida. Izo nizo zimwe mu mbogamizi kandi nanone n'imibereho mu rubyiruko igenda ihinduka, ugasanga bagenda bahura n'ibishuko bitandukanye bishobora gutuma bakwishora mu mibonano mpuzabitsina rimwe na rimwe itanakingiye, bikaba byaviramo kuba bakwandura virusi itera sida.
Iyo turebye mu myaka ishize, imyaka 20-15 ishize, umuntu wabaga afite virusi itera sida atandukanye n'umuntu dufite uyu munsi, kandi n'imibare irabigaragaza iyo umaze kutubwira. Ariko kandi nanone icyo gihe niba navuga ngo hariho ikitwa kato kinini cyane, hariho gutinya kwitirira virusi itera sida andi mazina ndetse no kugira ipfunwe mu ruhame. Mwakoze iki nka RBC kugira ngo ibyo bibe kimwe mu bibazo bishobora gukemuka?
Cyakozwe nka guverinoma y'u Rwanda, leta y'u Rwanda ibinyujije muri Minisiteri y'Ubuzima, hageragejwe ko haboneka serivisi zifasha abo bafite virusi itera sida, haba kubaha imiti cyangwa kubapima n'izindi ndwara bakabafasha kuba bavura ibyuririzi. Kera ntabwo byari bimeze kimwe nk'ubu ngubu, kuko kera tugitangira ntabwo buri muntu wese yabonaga imiti uko bikwiye, ariko kuri ubu ngubu umuntu wese ufite virusi itera sida ashobora kubona imiti ku kigo nderabuzima icyo ari cyo cyose cya leta kimwegereye. Hari n'ibigo nderabuzima byigenga bimwe na bimwe nabyo twagiye tubigezamo serivisi. Icyo navuga cy'intambwe yatewe nuko igihugu cyashyizemo ubushobozi buhagije, gishyiramo imbaraga kugira ngo izo serivisi zibe zaboneka kandi n'abantu bashobora kubona imiti kandi bakayibonera ubuntu binaboroheye. Hari ubukangurambaga bwabaye ko kubanza kumvisha abantu ko umuntu ufite virusi itera sida bitamubuzaho kubaho ubuzima busanzwe nk'uko yabiteganyije. Ibyo byose ni ubukangurambaga, abantu bakamenya virusi itera sida ni iki, yandura ite, wayirinda ute, ese uyifite yakwitwara ate, yafashwa ate. Ibyo byose ni ubukangurambaga bwagiye buba butuma bwaragiye bugabanya imibare y'abandi twabonaga bandura, kuko nako bagira ibyuririzi. Kuko iyo ufata imiti neza nta byuririzi ugira kandi ubaho ubuzima bwawe nk'uko wabuteganyije. Izo rero ni imbaraga zagiye zikusanyirizwa hamwe n'abafatanyabikorwa n'abandi baterankunga. Nanone nagizemo uruhare kubasha kumva bagasobanukirwa, bagasobanuza kandi bakagerageza no kugana izo serivisi ziba zabashyiriweho. Ibi byose ni ibyashyizwe hamwe kugira ngo tube twabasha kurwanya virusi itera sida, tube dufite ishusho dufite ubu ngubu. Ubumenyi kuri virusi itera sida mu Rwanda nka sosiyete duhagaze he? Nitujya mu mashuri, nitujya mu bigo byigenga, ibigo bya leta, nitujya mu muhanda, aho abantu bateranira, ubumenyi kuri virusi itera sida buhagaze bute? Niba mwarakoze ubushakashatsi bwagiye bugenda bugaragaza ko aho dufite icyuho cyane ni mu rubyiruko, aho usanga mu rubyiruko munsi ya 70%. Aho ngaho ntabwo nibuka neza imibare, ariko naho ngaho niho bigaragaza ko ariho dufite icyuho cyane mu rubyiruko. Ariko ahandi ho usanga ubumenyi buhagaze neza, ko urumva dufitemo ababyeyi bakuze babona iyo virusi itera sida, bakabona abarwayi, bakabona iki, bakabisobanurirwa cyane kandi bakanabyumva. Ariko usanga aho dufite icyuho cyane ari mu rubyiruko. Niyo mpamvu niba mwaragiye mukurikirana ibi yaba bukangurambaga dukora, twibanda cyane ku rubyiruko kugira ngo urubyiruko rube rwagerana rw'ubumenyi buhagije, kuko ifite ubumenyi buhagije nibyo bigufasha kwirinda, ukaba wakwirinda kuba wakwandura virusi itera sida.
Akenshi virusi itera sida navuga yuko ari ikiganiro kigiye mu ruhame vuba, ntabwo ari ikiganiro cyaganiriweho cyane abantu bakura babyiruka. Umuryango nyarwanda wakanguriwe ute kugira ngo umuntu atagira ipfunwe ryo kuganira kuri virusi itera sida, gushishikariza abandi kwipimisha ndetse rimwe na rimwe no kunywera imiti aho abandi bamureba?
Ikintu cya mbere twakoze nuko ari nacyo dusaba buri muntu, nuko virusi itera sida igomba kuvugwa, irahari. Ntabwo wavuga ngo ntihari kandi tugira imibare y'abayandura cyangwa n'abandi bose ishobora gutera ibibazo ko nta muti nta rukingo. Irahari. Icyo tuba dukangurira umuryango nuko bagomba kubiganiriza abana bakabimenya. ubu ntabwo wavanga umwana ngo nzamuganiriza kuri virusi itera sida wamaze kugira imyaka y'ubukure, ntabwo ari byo kuko nk'uko mubizi mu mibare tugenda tubona abangavu basama inda zitateganyijwe. Ibyo byose ni ibigaragara ko bya bishuko bya bindi bishobora gutuma twishora mu mibonano mpuzabitsina idakinye cyangwa imibonano mpuzabitsina na ya myaka itaragera, birahari, ibimenyetso birahari. Icyo rero tuba dusaba umuryango nyarwanda nuko twabiganiriza abana bakamenya ko bihari, ahubwo tukabereka ni gute wakwirinda virusi itera sida, ese uyifite wakora iki. Ibyo byose rero biba bisaba ngo dukorere hamwe, ntibibe ikiganiro gusa cya Minisiteri y'Ubuzima cyangwa n'izindi nzego, ahubwo tukumva ko ari ikiganiro cya buri wese, bireba buri wese, nk'uko yenda tuza no kubigarukaho cyangwa namwe muza kubibona nk'insanganyamatsiko iriho uno mwaka igenda ibigaragaza ko turi guhamagarira buri wese akumva ko kurwanya virusi itera sida ari uruhare rwe.
Yego, mbere yuko nkureka kugira ngo nakire na RP+ ndagira ngo utubwire uyu munsi ni umunsi uteguye ute, ni umunsi ukubiyemo iki, kugira ngo umuntu wicaye ategereje kureba ibigiye kubera hano amenye icyo kwitega.
Uyu ni umunsi ngarukamwaka ubusanzwe ku rwego rw'isi uba tariki ya mbere z'ukwezi kwa 12, ariko kubera impamvu zimwe na zimwe twe mu gihugu cyacu twaba twarahisemo kuwizihiza uno munsi iki gihe. Impamvu rero uwo munsi uriho ni umunsi tukazirikana abanduye virusi itera sida, tukazirikana imiryango yatewe ibibazo n'iyo virusi, ariko nanone twongera tukazirikana nk'inshingano za buri wese mu kwirinda virusi itera sida. Ntabwo tureba gusa abafite virusi itera sida, ahubwo tureba uruhare rwa buri wese. So ni umunsi rero tuba dutangije ubukangurambaga buzamara amezi 6, dufite insanganyamatsiko nk'uko nabivuze ruguru igira iti uruhare rwa buri wese ni ingenzi, niyo iba iturangaje imbere. Dukoramo ibikorwa byo gukangurira abantu kumenya virusi itera sida, kubamenyesha serivisi zo kurwanya virusi itera sida, bazisanga he, bazibona gute, uruhare rwa buri wese rumeze gute. Mbese nicyo kiba gikubiye muri uyu munsi. Navuga ko ari nk'itangiriro ry'ubukangurambaga bwimbitse tuba tugiye gukora buzamara amezi 6.
Urakoze cyane. Twatuma turaganira na Dr. Basile Ikuzo muri RBC, tujye kwakira na Deo muri RP+, aratubwira byinshi ku mibereho y'abafite virusi itera sida, kuko akenshi iyo tubiganira usanga rimwe na rimwe hariho n'imiryango, hariho sosiyete, hariho ibimwe mu bice mu gihugu usanga icyo ari ikiganiro kitari cyaba ikiganiro cyo kuganira mu ruhame, bitewe n'uko rimwe na rimwe bikitirirwa amazina. Deo, mwiriwe neza?
Mwiriwe.
Ngo ikaze.
Asante sana, murakoze.
Mwishimira iki mumaze kugera, ukadore ko byo mwishimira umuryango wanyu ndetse wenda n'abatari mu muryango, ariko mwebwe mwishimira iki?
Murakoze cyane. Mu by'ukuri icyo twishimira ni byinshi. Icya mbere turishimira yuko ubu ngubu mu gihugu nta mwana ushobora kuvuka ku bantu bafite virusi itera sida ngo avuke afite ubwandu. Icya kabiri ni uko akato n'ihezwa bimaze kugabanuka ku kigero nibura ibisigaye ni bike cyane kuruta uko byari biri mu myaka yatambutse. Icya gatatu, nk'uko wabonye abantu bari aha ngaha, nta muntu ukigaragaza ibimenyetso. Ni ukuvuga ngo umuntu ufite virusi itera sida iyo afata imiti neza akabahiriza gahunda zo kwa muganga amera nk'umuntu usanzwe. Ntabwo ari ikintu ushobora kuvuga ngo ushobora gupimisha ijisho, nk'uko tuzi mu minsi yatambutse aho abantu babonaga yuko kuba bafata imiti batasobanukiwe neza, wabonaga yuko ari ibintu bigoranye, kandi noneho n'akato kari kanini cyane mu gihugu no ku banyamuryango. Aho usanga mu muryango bamenye ko ufite virusi itera sida, ugasanga barakuheza, baraguha ibiryo byawe wenyine, isahane yawe wenyine. Ibyo byose rero byo twishimira nuko twicaye ku meza n'abandi banyarwanda n'abandi baturarwanda. Ni ukuvuga ngo ntabwo byakorohera umuntu uwo ari we wese kugupimisha ijisho ngo akubone yuko ufite virusi itera sida.
Tugiye kuri RP+, umuryango wanyu ndagira ngo uwusobanurire umuntu udukurikiye kuri televiziyo na radiyo by'u Rwanda adasobanukiwe, wenda afite virusi itera sida, yabasanga he? N'umuryango ufite izihe nshingano?
RP+ ni ikigo gishinzwe kureberera inyungu z'abafite virusi itera sida no gukumira ubwandu bushyashya. no kubafasha mu buzima bwa buri munsi ku bigendanye n'imibereho yabo. Ni ukuvuga ngo biciye mu bajyanama b'urungano abo twita abaperedikateri, ahantu kugera ku rwego rw'akagari haba hari abantu babishinzwe, ku buryo ugize ikibazo kigendanye nuko wenda atabonye imbaraga zo kujya gufata imiti, abantu baragenda bakayimufatira, baba bazwi. Ariko dufite na call center aho abantu bashobora kutubonaho 1245 ni umurongo bashobora kutubonaho, ku buryo abantu bakeneye serivisi zacu, harimo kurwanya iryo hezwa hagati mu miryango, hakazamo kureberera abantu bahuye n'ihungabana, hakazamo urubyiruko cyane cyane bafite abajene bagenzi babo bahura bakajya inama bakava mu ntuza mu ihezwa, ku buryo usanga bafite aho bahurira bakaganira, ubuzima bugakomeza. Ntekereza yuko akamaro dukora mu gihugu hose, RP Police ikorera mu bigo nderabuzima byo mu gihugu hose. Rero dukorana n'ibigo nderabuzima, bashinzwe ubuzima n'abaperedikateri hamwe n'abakozi ba RP Police nyirizina babarizwa muri buri karere.
Nituvuga ndagira ngo duce akarongo ku bwandu bushya. Ubwandu bushya ni iki? Ese ubu bwandu bushya mwadusobanuriye yuko ubu ngubu umwana afite amahirwe yo kuvuga ku babyeyi bafite virusi itera sida ariko akavuka ntayafite. Icyo gihe kubimenya biroroshye kuko umwana wenda avukiye kwa muganga, ariko imibare iratwereka yuko abakiri batoya bitewe n'impamvu Dr Basile yaduhaye, hari ukwishora imibonano mpuzabitsina idakingiye n'ibindi, hashobora kuboneka ubwandu bushya. Ubwandu bushya mu bukumira gute? Birashoboka?
Tumaze mu nshingano dufite guhangana n'ubwo bwandu, ni primary goal ya RP Police. Bivuze yuko turwana no gukora ibiganiro bitandukanye, dufite social media influencers, urubyiruko rwacu, ari abafite ubwandu ari n'abazima, nabo batanga ibiganiro, ariko noneho no mu makampanye turayakora. Nk'uko ubu ngubu dutangiye uyu munsi ni umunsi wo kurwanya SIDA ku isi yose, ariko ubu dufite gukora kampanye igihe cy'amezi 6, kugira ngo ubu turateganya kujya mu mashuri, turateganya kujya ku rwego rw'imiganda mu baturage, tunakoranye n'inzego z'ibanze, kubera yuko ibi ni ibintu biganirwa mu muryango, kandi ubuzima bw'imyororokere, umubyeyi afite inshingano primaire yo kuganiriza umwana we. Utabonye umwanya w'umwana wawe ntago byakoroha yuko umuntu wo hanze. Rero turashishikariza yuko n'ababyeyi dukorana hafi na hafi mu bajyanama b'urungano, itangazamakuru, aba social media influencers.
Gusa biracyoroshye kuko tuganira ku buzima bw'imyororokere, iyo ni ingingo nayo ijya ibandende ku babyeyi, vuga ati nge nabibwiwe nande, ese ko nifashe neza, ko nitwararitse. Aba babyeyi mubashishikariza muti? Biraboroheye mwebwe? Ese birashoboka?
Ntabwo byoroshye ariko birashoboka, cyane kubera yuko nk'iyo turebye aho igihugu cyacu kivuye, nk'ubu turimo turafite imyaka 20 ya RP Police imaze ivutse. Ni ukuvuga ngo urabona yuko aba banyamuryango bari ahangaha, urumva aba ni abantu biyakiriye, urumva ni abantu bafashije igihugu mu kuvuga ububi bwa virusi itera sida, mu kurwanya ubwandu bushyashya. Aba ni ababyeyi bari hano bafite abana bafite ingo, kandi abo bana ni bazima. Rero ni ikimenyetso cy'uko bishoboka. Noneho ikiba gisigaye ni twebwe nk'abandi tuva mu byo nakwita nk'imico yacu, kuko ibihe birahinduka, kandi ibihe nibyo bituma tugomba kubabo tugomba kubabo. Ngo nimba ibihe byahindutse n'ubuzima burahinduka. Nimba ubuzima bwahindutse tugomba gutinyuka kuvuga bya bindi twitaga kirazira mu muco nyarwanda. Kandi noneho ntabwo ari na kirazira, kuko ni ukwigisha, ni uburere, ku buryo umwana amenya ngo jyewe mfite imyaka 10 ntangiye kumera amabere, nagiye mu mihango, ese nimba nafashe icyemezo cyo gukora imibonano, ndakora imibonano nabitekerejeho, ese ingaruka z'imibonano ngiye gukora bigenda bite? Ntabwo nkibibona nk'ikintu kidasanzwe, ahubwo twemere yuko igihe cyahindutse, ibintu tubivuga uko biri, tunasabe abo dufatanyije mu midugudu, urumva, mu midugudu, mu masibo, ku tugari, byose ibyo biganiro bitangwe, kubera yuko iyo biba bitaratanzwe ntabwo twari kuba turimo kuvuga ibi ngibi mu gihugu cyacu. Ndabizi ko byabaye, murabizi ko byabayeho.
Reka tuvuge ku bwoko bushya bwa akato ka mbere, ngira ngo twese turakazi, kari ako kureba umuntu ukavuga uti rega uriya muntu yararwaye, yaranduye, igiswaku cyaramufashe, ariko ubu ngubu habayeho ubundi bushya, ubwoko bushya bwa akato, kujya kwipimisha mbere yo gushyingiranwa, mukabanza kubyereka padiri, kubanza kwisobanura imbere ya buri umwe wese. Ibi mubikoraho iki? Kuko zimwe mu nshingano mwatubwiye nabyo birabareba, mubikoraho iki?
Murakoze cyane. Dukorana na, tuvuge nk'urugero nk'ibyo uvuze by'abapadiri, dufite umuryango dukorana nawo witwa RICH, ushinzwe guhuza ibigendanye n'imyemerere, inzego z'amadini zitandukanye. Ubutumwa dutanga ni uko icyo gihe amahitamo ya muntu ntabwo ndumva kesi y'aho umuntu yanze kugaragaza icyangombwa ngo banjye kumusezeranya. Ibyo bintu byabaye biba ari akato gakabije, kubera yuko guhitamo kubana uwo muzabana ni uburenganzira bwawe, kandi aba bafite virusi itera sida nabo bafite uburenganzira, abafite virusi itera sida bafite uburenganzira kubaka ingo kandi zikabaho zigakomera kandi bakabyara, kubera yuko hari uburyo igihugu cyashyizeho. Nimba igihugu cyarashyizeho ubufasha nk'ubu nka RRP Police, twe tubibona nk'intambwe ihambaye, no kuba tuganira bino izi ngingo ubu nona ni intambwe ikomeye, kandi aho twavuye niho hari hagoye. Hasigaye ni ukugenda tuzamura imyumvire imwe n'imwe ku bantu bamwe na bamwe, ku miryango imwe n'imwe. Ntabwo mpamya ko ari igihugu cyose, kuko nk'urugero ntabwo mu murenge bashobora kujya gusezeranya ngo bakubaze ngo uzane icyangombwa kigaragaza ko udafite virusi itera sida. Oya, ibyo rero ni ibintu turwana nabyo umunsi ku wundi, ni ukwigisha, ni ubuvugizi dukora dufatanyije n'inzego za leta mu buryo butandukanye.
Hari umuntu udukurikiye wumvise insanganyamatsiko uruhare rwa buri wese ni ingenzi, buri wese nindi. Ese umuntu wipimishije, wenda wanipimishije agasanga nta virusi itera sida afite, uruhare rwe ni uruhe? Biramurebaho iki?
Uruhare rwa buri wese ni ingenzi, niyo insanganyamatsiko y'umunsi. Ni ukuvuga ko iyi nsanganyamatsiko iratubwira ngo jyewe mukuru mu rugo mfite inshingano kubwira icyo umwana atazi, kuko abana bagira amatsiko. Ni uruhare rwanjye kubwira abana banjye, ni uruhare rwawe kubwira abana bawe, ni uruhare rwawe gushishikariza umuturanyi wawe kubwira abaturanyi be nanone, kuko ijambo ry'umuturanyi ryihuta kuruta ubundi buryo bwose twatambutsa, kuko barizerana. Umuntu mwizerana rero umugirira, umuntu ufitiye icyizere, icyo akubwiye ukimva gutyo kandi ukacyumva nk'ukuri. Rero uriya wipimishije agasanga adafite virusi itera sida, namushishikariza kwirinda gukora imibonano idakingiye. Icya mbere yirinde, niba byanze kwirinda nakora imibonano mpuzabitsina ariko ikingiye, kugira ngo akumire ubwandu bushya, kuko igihugu gishyiramo ubushobozi bwinshi cyane, urumva. Rero turimo turashimana nko mu Rwanda, kubera yuko u Rwanda rutugurira imiti, urumva. Iyo ruguze imiti, nta muntu ufite virusi itera sida, urumva, ugura imiti kwa muganga, bafata imiti y'ubuntu, urumva. Kandi n'udafite imbaraga, dufite nk'ufite virusi itera sida ariko afite n'ubumuga, uwo muntu imiti barayimushyira iwe mu rugo. Kandi ubu tugeze ku rwego rw'aho bafata imiti y'amezi 6 bakanikorera n'iyindi mirimo. Urumva yuko ibyo kwishimira kurinda ubwandu bushya bizagenda gahoro gahoro bituvana muri uwo murongo, tunahangana n'ibindi bibazo dushobora kuvuga nk'abantu bafite virusi itera sida bageze ku myaka mikuru. Ubwo ni ukurwana no gushaka ko tubakorera ubuvugizi bakazamura imibereho myiza yabo, bagakomeza kubaho kandi bakabaho neza. Urumva rero uko umuntu akura niko imbaraga zigabanuka. Ibyo ni ibyo twakabaye, nibyo turi mu gukora, ariko tutibagirwe no gukingira, gukingira cyangwa se kurinda ubwandu bushyashya. Niyo mpamvu navuga ngo ni uruhare rwa buri wese, ari ureba televiziyo y'u Rwanda cyangwa wumva radiyo y'u Rwanda, ari uri hano, ari n'undi utari mu kuyireba, ariko nshishikariza abarebye nibura bakabona aya makuru bayahe bagenzi babo.
Ubu sosiyete babaniye gute, usibye wenda ibyo abantu bashobora kuganira mu matsinda, bashobora kukuvuga wenda ubumva muri quartier, sosiyete abanyarwanda babaniye gute mu buzima busanzwe? Muratirana, barahurira, bimeze bite?
By'ukuri kugira ngo urebe ko imibanire y'abantu igenda ihinduka, icyo umaze muri community aho utuye, nimba uri umuhinzi mwiza ntabwo bajya kuvuga ngo wowe ngo ufite virusi itera sida ntabwo baguhahira. Dufite amakoperative urumva yemporota nk'imboga yohereza hanze, ayo akorana na NAEB urumva. Rero nimba ikigo cy'igihugu n'urugero gishinzwe ku ubucuruzi bwambukiranya imipaka kigurira ayo makoperative, ntabwo bagurira kubera yuko ari abantu bafite virusi itera sida, babagurira kubera ibikorwa byabo. Ni ukuvuga ngo imbuto twerera abantu nizo natwe batwerera, kandi ibyo ni ibisanzwe mu mibanire y'abantu. Ubu ngubu ntabwo sinavuga akato kararangiye burundu, ariko navuga yuko aho bigeze bitandukanye n'imyaka yashize. Nko muri za 2002, 2003 hakiri za CHK batuvuga muri 4, ayo ni amateka. Ubu igihugu cyacu kigeze kugera ko nibura abantu 95 bazi uko bahagaze. Ikindi cyiciro 95 baripimisha, 95 nanone bari ku miti urumva. Kuba dufite abanyamuryango bagera mu barenga 100,000 nuko akato karagenda kagabanuka, kuko abantu baraza bakatubwira ibibazo bafite tukabentegra mu bandi kandi bagakorana.
Reka tuganire ku mvugo pfobya. Imvugo pfobya zihagaze ziti muri no minsi? Ese mukora iki kugira ngo niba hari amagambo mashya mutifuza ko akoreshwa, ayo mwifuza ko akoreshwa, muyamenyekanisha mute mu bigo by'amashuri, mukorana mute n'ibindi bigo kugira ngo hatagira umuntu ubyuka mu gitondo akaba yavuga n'ijambo atazi ko ari imvugo pfobya arimo arakoresha, ukaba wakomereka, ariko nanone uruhare rwawe nawe utarukoze rwo kumumenyesha?
Nkurikije ubushakashatsi RP Police yakoze mu mwaka umwe n'igice ushize, nuko bigendanye n'akato kanini kaboneka mu mashuri y'abiga babamo, ayo nakwita boarding schools. Nkaho umwana ajyana imiti, umwana ku ishuri basaka kumwe basaka bayibona, ugasanga kumubikira ibanga biranze, akabwira undi, bigatuma abantu abo bana kenshi ubona batisanga muri iyo community. Ariko dufatanyije na Minisiteri y'Ubuzima n'ikigo cy'igihugu gishinzwe ubuzima RBC n'abafatanyabikorwa batandukanye, turimo turakora imfashanyigisho zo guhugura abarezi, abarimu n'abadirekiteri b'amashuri, bikazakorwa binyuze muri Minisiteri y'Uburezi, kubera yuko icyiza tugira igihugu cyacu ni decentralization. Minisiteri zirakorana, ntago wakora wenyine. Ubwo rero iyo ikibazo nk'icyo cyabonetse, icyo dukora nuko duhamagara inzego zibishinzwe, abarimo minisiteri, tuvuge minisiteri z'uburezi, inteko nshingamategeko, bakadufasha gukora ubuvugizi. Rero ni ikibazo kireba RP Police, ariko kinareba inzego zose, ku buryo mu gukorana niho duteze igisubizo cy'umuturambye. Kandi ndahamya neza yuko turavuga tukumvwa, bakumva ijambo ryacu, ariyo mpamvu ubona tugeze kuri uru rwego mu by'ukuri.
Iyo tuganira kuri virusi itera sida, akenshi usanga kugira ngo umenye yuko umuntu abasha kukwisanzura akubwira ati ariko ngewe burya mfata imiti kandi rwose nta kibazo, usanga kugira ngo umuntu azisanzure abasha kwivuga mu ruhame nabyo biracyari ikibazo. Mwebwe hagati yanyu muganira mute, muganiriza mute bafite virusi itera sida, nk'abantu bagiye ku ishuri mugasobanukirwa mukamenya byinshi yuko umuntu ashobora no kubaho igihe kirekire? By the way, mubigisha gute ko atari iherezo ry'ubuzima? Mubigisha gute ko uko uganira muri sosiyete ariko n'ubundi umuntu azakwakira?
ikintu kidufasha muri iyi minsi twakoze amatsinda atandukanye, ni ukuvuga ngo abajene ku bajene, abamama bakuze cyangwa abagabo bakuze bakaba bari kumwe. Rero twebwe icyo tubakorera amahugurwa aho haba abajyanama b'urungano. Bariya abajyanama b'urungano bakora ku nzego z'utugari niwo muyoboro woroshye, kubera yuko umujene uhari abaziranye n'undi mujene. Noneho kugira ngo baganire kandi bamaze kugera aho batinyuka bakabivugira mu ruhame, kubera ko sida, virusi itera sida ni wagize discipline, nta kintu cyatuma utahagarara wemye ngo wumve yuko nta kazi ak'umuntu udafite virusi itera sida yakora kananira uwo ufite virusi itera sida. Rero kubera uko kuzamura imyumvire dufatanyije n'inzego z'igihugu zishinzwe ubuzima mu buryo butandukanye, bidufasha gutambutsa ubwo butumwa. Kandi twebwe n'abantu baza kuri ofisi, tuvuge hari nk'abaganga nk'urugero bajya baza kundeba kuri ofisi bakambwira bati ngiye nkorera aha n'aha, ariko ntabwo numva nkeneye kujyaho nkorera ngo mfate imiti. Urumva kandi ari umuganga ko nihezwa bwite, nicyo nakwita self stigma, kuba umuntu yiheza ku giti cye. Icyo tumufasha tuba dufite, tumubaza hamworoheye. Dufite ibigo nderabuzima dukorana nabyo, dufite amavuriro dukorana nayo, ku buryo tumuherereza umuganga wacu uriyo akamureba akamwitaho. Rero hari ingeri nyinshi, hari uwumva atariyakira, hari uburyo dufite abakansara tubegereza bakabakansara. Mu bakozi ba RRP Plus harimo abakansara, hari abafatanyabikorwa badufasha nk'ibitaro bya CHIB, ibitaro bya CHIK, ibitaro by'Indera, dukorana nabo muri izo porogaramu ku buryo baba bafite abantu ugize ikibazo kirenze ubushobozi bwa RRP Plus, twebwe tuhaha dushaka abaganga babigenewe bakagira gute bakagera abo bantu ku buryo bagenda babubaka mu myumvire, ko cyane cyane ni ibintu bituruka mu muntu. Kuba kwiheza ni bwite.
Muhura n'izihe mbogamizi rero, kuko ukuntu urimo uradusobanurira hashize igihe yego mukora imyaka 20 n'imyaka myinshi, ariko ibintu byose birasa n'ibiri ku murongo. Kuri uno munsi nyuma y'imyaka 20 muracyahura n'izihe mbogamizi?
Mu by'ukuri imbogamizi ni nyinshi. Uko imyaka ishira, urumva kera twakoreshaga muri prevention cyangwa se mu kurinda ubwandu bushya, wabonaga amakampanye mu gihugu hose. Ni ukuvuga ngo icyo gihugu ubushobozi bwari buhari, ariko uyu munsi ubukungu uko bw'isi buhungabana niko natwe izo ngaruka zitugeraho. Ni ukuvuga ngo ntabwo ubushobozi nakwita bw'amafaranga, urumva buragenda bugabanuka. Ikindi dufite communauté y'abantu bakuze. Abantu bakuze bakeneye kwitabwaho mu buryo bwihariye, urumva nubwo hari gahunda za leta nk'ubudehe n'izindi zishamikiyeho ku bantu batishoboye, ariko abanyamuryango ntabwo ari ukuvuga ko batishoboye, ahubwo bakeneye kuzamurirwa morale, kubera yuko ni ubundi buryo bwo kubitaho kandi bugaragaza psychosocial support, ku buryo uwo muntu ufite virusi itera sida uri mu myaka 60, aho kugira ngo yumve yuko bicitse kubera yuko ageze muri iyo myaka, ahubwo yumve yuko nicyo gihe cy'uko yajya inama yegerewe ku nzego zose z'ubuyobozi zitandukanye aho dutuye. Ibindi ni iterambere. Ubu urubyiruko impamvu hari ubumenyi bukeya kubera ko byinshi barisomera, ariko kugira ngo wowe uzamusobanurire, kandi amakuru yose dusoma ntabwo ariko agendanye n'ukuri. Amakuru nyayo bagomba kumenya aho bayakura. Izo ni imbogamizi. Noneho ikindi twahoze tuvuga ngo igihe CHK hari icyumba cyahariwe abantu bari bafite ubwandu virusi itera sida, icyo gihe ntibikibaho, urumva. Ni ukuvuga ngo aba bana impamvu ubona n'ubwandu bugwira cyane, nta muntu bazi wajahajwe na virusi itera sida. Urumva we ugasanga ahubwo gutwita nicyo kibazo. Rero ibigaragara ugasanga ararinda ibigaragara kuruta ibitagaragara. Kandi mu by'ukuri nubwo dufite imiti, nubwo dufite leta itwitaho, ariko mu by'ukuri numva gutsinda bishoboka buri muntu abigize ibye. Ni uruhare rwa buri wese kugira ngo uru rugamba rwo kurandura virusi itera sida mu Rwanda no muri Afurika ndetse no ku isi byashoboka ariko buri muntu abigize ibye.
Turi kugana ku musozo ariko sinakurekura utambwiye. Twari dufite amwe mu club twize n'ubu ngubu ngira ngo ahari kandi yarakomeye ni anti-sida club zatangaga amakuru ndetse zaranasurwaga cyane. Imbaraga ubu ngubu muri kuzishyira he aya maklub abantu baracyajyamo cyane ko ari club ubu ngubu abana ukurikije ukuntu babivugaga ukuntu abana bateye imbere basa nkaho izo club batakizibonamo cyane. Mwebwe muzisura gute, muziha imbaraga gute? Turi kugana ku musozo.
Icyo dukora nahoze nkubwira ko ubu ngubu tuvugana RRP Plus imaze gukora amatsinda y'abana bagera muri 400 barenga 400 mu nzego zitandukanye kandi mu bice bitandukanye by'igihugu. No kuvuga ngo abo nabafite kandi bemeye urumva gutanga ubuhamya no kwigisha. Ubu turimo turakora social media platforms zabo kugira ngo tujye tutambutsa ubwo butumwa. None ko bigendanye n'amakarabu anti-sida mu bigo by'amashuri bizaba bikubiye muri za nyigisho fashanyigisho navuze haruguru turiho dukoraho dushaka kuzakira mu mashuri abanza n'ayisumbuye, kubera yuko niho tugomba kugaririra cyane. Kandi noneho n'aba bajyanama burungano b'abajene bemera yuko bagomba kudufasha kujya ku mashuri bakavuga ubuhamya bwabo, kuko nimba ahagaze ntiwamupimisha ijisho, ariko ahagaze hari akabikwibwirira. Nirwo ruhare rwawe, nirwo ruhare rwe rwo kugira ngo wemere yuko ntabwo virusi itera sida ipimisha ijisho, kandi nirwo ruhare rugaragaza yuko virusi itera sida ikiriho.
Imihango igiye kubera hano ngira ngo igiye gutangira, reka tube duhiniye hano, turaza kongera usubira nyuma. Imihango igiye kubera hano igiye ku musozo.
Twahaguruka muhaguruke tumwakire hamwe n'abashyitsi turi kumwe. Duhaguruke kandi tumakirize urugwiro n'amashyi menshi. Tubakire abayobozi bacu.
Please, you may have a seat.
Mushobora kwicarira.
Honorable Minister of Health. Good afternoon once again. Thank you. Honorable Minister of Health, UN Resident Coordinator, PEPFAR Coordinator, RRP Plus Chairperson, WHO Country Representative, Rwanda NGO Forum Executive Secretary, good afternoon. Distinguished partners, ladies and gentlemen, good afternoon. Today, Rwanda will join the rest of the world to celebrate the World AIDS Day 2023 under the theme, Every Voice Matters. Here at Kigali Convention Center, we are joined by 1,500 people, including including staff and leaders at the health sector, distinguished partners, and beneficiaries. All of us are gathered here to this annual event, which is special to us, and This year, we will join the rest of the world, as I mentioned, under the theme, Every Voice Matters. Ladies and gentlemen, I am Dr. Vanessa Mupenzi, Director of HIV Epidemiology and Research at RBC, and I'll be one of your MCs for today.
Arakoze Vanessa kubakurikira mu rurimi rw'Ikinyarwanda. Tubahaye ikaze, ngewe nitwa Moise Tuyishimire, ni umukozi wa RBC mu ishami ryo gutanga amaraso ahabwa abarwayi kwa muganga. Mbibutsa ko anagira uruhare runini cyane ku barwayi cyangwa se ku bafite virusi itera sida. Uyu munsi rero nk'uko tubizi twese ni ku itariki umunsi twizihizaho umunsi mpuzamahanga wo kurwanya sida. Tubahaye ikaze muri iyi nzu. Nyakubahwa Minisitiri w'Ubuzima, tubahaye ikaze muri uyu munsi. Duhaye ikaze kandi umuyobozi uhagarariye amashami y'umuryango w'abibumbye mu Rwanda. Duhaye ikaze umuyobozi wa PEPFAR. Duhaye ikaze uhagarariye umuyobozi wa polisi y'u Rwanda. Duhaye ikaze kandi umuryango mugari w'abakora mu nzego z'ubuzima. Nabonye hari abayobozi b'ibitaro batandukanye n'abandi bakora mu nzego z'ubuzima. Tubahaye ikaze namwe hano. Duhaye ikaze kandi abafatanyabikorwa batandukanye bari hano. Duhaye ikaze abagenerwabikorwa mwese mwateraniye hano. Turi hano tugera ku bantu 1,500. Ni abantu benshi. Bigaragara yuko twashyize imbaraga hamwe mu kurwanya virusi itera sida. Intego y'umwaka iravuga ngo uruhare rwa buri wese ni ingenzi. Iyo ntego rero irahamagarira muri rusange abantu twese kugira uruhare mu bikorwa byo kurwanya sida, ariko kandi akaba ari n'umwanya mwiza wo kugira ngo dukomeze gushyira imbaraga hamwe mu rwego rwo kurwanya sida nk'uko bigaragara muri insanganyamatsiko y'uyu munsi. Twizere ko twese uko turi hano tumeze neza. Tugiye kubanza twakira inganzo ngari. Inganzo ngari mwakwigira hino mukadusurutsa.
Abashitsi bahire murakarama, mwicare mugwe neza murakarama. Abashitsi bahire murakarama, mwicare mugwe neza murakarama. Yeni muze murisanga murakarama, tubakiranye ubwuzu murakarama. Abashitsi bahire murakarama, abashitsi bahire murakarama, mwicare mugwe neza murakarama. Yewe inganzo ngari z'u Rwanda murakarama, turatarama dukeshe murakarama. Yewe abashitsi bahire murakarama, mwicare mugwe neza murakarama. Cyongwa ino bibera by'uruyombo murakarama, byuhirirwa w'inyambo murakarama. Abashitsi bahire murakarama, mwicare mugwe neza murakarama. Abashitsi bahire murakarama, mwicare inkingi twegamyeho ishema ryawe ntirihinyuka Rwanda rw'intwaro ubaye ukombe wibarutse intwari by'ukuri rwose ziruharanira zirurwanira ng'umuco wacu udatezuhuka Rwanda rwatubyaye inkingi twegamyeho ishema ryawe ntirihinyuka Rwanda rw'intwaro ubaye ubukombe ishema ryawe ntirihinyuka Rwanda rw'intwaro ubaye ubukombe yewe gomba amahine warara kenyera ukerereza abagenzi akogariza u Rwanda gomba amahine warara kenyera ukerereza abagenzi turatarama dukeshe warara kenyera ukerereza abagenzi gomba amahine warara kenyera ukerereza abagenzi turatarama dukeshe gomba amahine warara kenyera ukerereza mweza wemwe naho baba yombe musana yamiriwe nderongo yamurare yego mweza wemwe naho baba yombe musana ngangari zurwanda yamurare yego mweza wemwe naho baba yombe musana kariza kariza bano yamurare yego mweza wemwe naho baba yombe musana gitonda kambo yamurare yego mweza wemwe naho baba yombe musana
Special thanks to Inganzongari, our cultural troupe. Next on our agenda, we will have a panel that will discuss, a panel that promises to unveil the journey of HIV response in Rwanda. Ladies and gentlemen, allow me to welcome here on stage the moderator of our panel, Dr. Giselle Mujawamariya, who is also a doctor in the HIV division at Rwanda Biomedical Center, and she will help us welcome our panelists. Giselle, the floor is yours.
Mwiriwe neza. Good afternoon, everyone. Happy World AIDS Day. I'm Dr. Giselle Mujawamariya, a pediatric senior officer in the care and treatment unit within the HIV division at Rwanda Biomedical Center. It's an honor to be a moderator in this session, where we'll be discussing the HIV journey response in Rwanda. We'll hear from different perspectives, the government, partners, civil society organization, and the recipient of care. I have some house rules. We'll be using both Kinyarwanda and English in this session. I hope everyone got their translator kits if you need them. If not, we have people in the alleys. You can just raise your hand and they will assist you. As I call upon our panelists to join me at the stage, I would like to ask you to reflect on this year's theme, Every Voice Matters, and introspect within your institutions and places of influence. How are you amplifying the voices of those communities you are serving? So first on our panel, we have Dr. Corneille Ntihabose. He is the head of Department of Clinical and Public Health Services in the Ministry of Health. His department is responsible for coordinating the overall strategic management, policy development, coordination oversight, and evaluation of health services. Dr. Corneille, welcome. Next is Ms. Hindi Hassan. She is the country director, UNAIDS country director. Her experience with UNAIDS spans 18 years in different advisor roles, including advocacy, community mobilization and support, resource mobilization, strategic planning, and joint programming to accelerate the national HIV response. Ms. Hassan, you're also welcome. Our next panelist is Alexandra Hoagland. I hope I pronounced that right. Yes, she is the PEPFAR coordinator, and she has worked for more than 14 years in public health and development, When she relocated to Rwanda in 2016, she managed PEPFAR-funded program as Key Population Program Coordinator, and then later she joined the PEPFAR Coordination Office in 2018, where she's currently serving as the PEPFAR Country Coordinator. Welcome. Up next, we have Mrs. Kabanyenda Nuliet. She has been a champion for health communities over 10 years and currently serves as the Executive Secretary for Rwanda Angel Forum on HIV/AIDS and Health Promotion, a network of 139 NGOs working on health and human rights. Mrs. Nuliet, please welcome. Our final panelist is Mrs. Sylvie Muneza, currently serving as the chairperson of Europa Plus. She's a successful businesswoman and esteemed founder of the local NGO, Igihozo, dedicated to providing support for individuals impacted by HIV with a specific focus on orphans, widows, and key population. Mrs. Muneza, please join us. Thank you again for joining us. Can you all see me? All right. The government of Rwanda has come an incredible distance in the past 2 decades. It has adopted a multi-sector response to HIV epidemic. This was after realizing that the impact of AIDS epidemic was far-reaching and beyond the health sector. Various policy and programmatic instruments have been put in place to control the spread and mitigate the impact of AIDS epidemic on society and the economy. Dr. Corneille, how would you rate the government's progress in terms of policy and strategies to address the changing dynamic of HIV epidemic over the past 2 decades?
Thank you very much. I try to respond to this question by elaborating 2 scenarios. A current medical officer sitting in the medical office with a patient, 69, 70, or 50 years, who is HIV positive, who is suppressing his viral load, but because she's or he's an older person, that medical officer is trying to take a BP to know or to assess if the patient is having hypertension, to diagnose maybe diabetes, and whatever NCD that can be a comorbidity to that patient. Yes. That first scenario. The second scenario is in 2000. A medical officer sitting in the medical office with many patients, with no hope, with no drug, with many opportunistic diseases from the patients presenting to the medical office. That was a clear picture, and is showing the long journey this country has made. But we have specific and special journey as country, because 2 decades ago, the country was coming from a genocide that has taken, we registered more than 1 million during the genocide. An economy which was devastated, the health system which was also devastated, everything was priority. And if you look at communicable disease, HIV, TB, malaria, the NCD was like a submerged iceberg. No one was caring to NCD. We had poor indicators. At least 1 to 5 kids were dying. 1 to 100 mothers were dying at the hospitals. 1 to 2 kids were stunted. We had poor indicators, rampant communicable diseases, and NCD, no one was caring. So there it started a rebuilding of the nation, but everything was priority: education, health sector, infrastructure, whatever. I imagine the former ministers were competing to Minister of Finance for budget to allocate some funds to every priorities, training the workforce, building the infrastructure, whatever. But health sector started by rebuilding the financing system, PBF, community-based health insurances, but we build on HIV as catalyst to build the health system. The infrastructure from the grant donors and also the few raised domestic financing were used as platform to rebuild the health system. If it is a health center, if it is a laboratory system, if it is workforce allocated or because we have external funding, whatever, those were serving HIV response, but also even serving for primary health care and also for other care like secondary and tertiary care. Of course, we had many challenges as years were coming, but HIV served as catalyst for funding from external and also domestic funding, and also as countries setting priorities, using properly the funds to set some targets, and also having social impacts from the funding we're receiving and also raising domestically. So I can rate our journey in HIV response as that, and we are celebrating as Rwanda achieving 95, 95, 95 and going beyond, because we went through that journey and were bold enough and to take some right actions and interventions to respond to the HIV.
Right. Yes, thank you so much, Dr. Corneille. From what I've heard is that we all had hands-on, be the government, be the donors, be the community, for us to be able to where we are. And I would like to hear from a funding perspective, can you elaborate on the contribution to the fight against HIV over the past 2 decades in Rwanda?
Sure. Thank you, Dr. Giselle. So I can speak on behalf of the US government and PEPFAR and the actions we have taken to respond to HIV. So PEPFAR was established in 2003 as an emergency response to the global HIV/AIDS epidemic. The government committed resources to rapidly respond to HIV, and I believe this was the first and still only time so many resources were put towards a single disease. So this was a game changer for a lot of countries. In Rwanda specifically, PEPFAR started in 2004, and since its launch, the US government has given through PEPFAR $1.7 billion to the response. And we can see a lot of that funding going through the Ministry of Health and some excellent programming. We see it in our flagship programs such as prevention of mother-to-child transmission, Test and Start, which I believe launched in 2016, which really changed a lot of lives, especially PLHIV, who were able to access treatment immediately. Orphans and vulnerable children funding, prevention activities with adolescent girls and young women, and our focus now in targeted response to key populations and high-risk populations. And I think the government of Rwanda and implementing partners, everyone in this room, have really set an excellent example of what countries are capable of. Rwanda is at the forefront in terms of PEPFAR countries, in terms of ownership of the response, leadership, and the achievements thus far. So it's really remarkable how far we've been able to come in the past 20 years.
Right. Thank you. A round of applause, please. Thank you so much. The recent UNAIDS reports that Rwanda is among 5 countries that have reached the triple 95. And with the UNAIDS vision of 0 new infection, 0 discrimination, and 0 AIDS-related death, a principle of not leaving anyone behind. How have the UN agencies contributed to the achievement of global targets? And please also highlight the strategies that were put in place to meet the changing global commitment in the fight against HIV in Rwanda.
Thank you, Dr. Giselle, and I start by saying good afternoon to everybody. Most of you I know we've worked as UNAIDS closely with. And I want to start, Dr. Giselle, by acknowledging the fact that Yes, Rwanda has been acknowledged as one of 5 countries achieving the targets, but I want to go further and say that Rwanda has achieved the targets ahead of time. And this in itself is a big achievement and a big acknowledgement. So while the targets are for the targets are and the goals are set for 2025, Rwanda is already there. And I want to also add my voice to Ali's to also acknowledge the strong ownership and leadership of the government under the leadership of the Ministry of Health. And I think this success and this progress has also would not have been possible had we not have a very strong and prominent civil society participation in reaching that progress. So again, I also acknowledge all the communities that are present here. And in terms of the UN, I think the role of the UN has been so far, especially recently, in the last few years, is really to provide the expertise to the government. The government has the full ownership and leadership of the HIV program. The government is fully on the driving seat, but the UN agencies in Rwanda has been supporting in terms of providing the technical assistance, in terms of facilitating south-to-south sharing of information and knowledge, and in terms of facilitating technical assistance in general. But I want to take a moment also to talk about we're speaking about the UN system as a whole, but I want to acknowledge the different agencies within the UN system in Rwanda, because each one has a separate mandate, each one has a comparative advantage. And I just want to list them very quickly, and I see most of them are here. And so we have WHO that's working and supporting the government with the integration agenda of HIV and helping to facilitate and have that progress in testing and treatment. And this is one of the areas that Rwanda has scored high and achieved the goals in, the testing and the treatment of HIV. UNICEF is also supporting with elimination of HIV mother-to-child transmission and making sure that mothers are staying alive and the children are staying alive. UNFPA is supporting with HIV prevention among young people and adolescents, and of course integration of HIV into sexual health and sexual and reproductive health. UNICEF also on young people, but also HIV in the education sector. And UN Women into gender inequality and GBV and closing that gender gap with regards to access to HIV services. UNHCR has been leading on coordination of HIV within the refugee camps, so has WFP, and WFP is also providing social protection to people living with HIV within the camps. ILO is a recent addition to the HIV family in Rwanda, and now they'll be working on HIV in the workplace and social protection. We have a couple of more agencies. We have IOM also working on HIV and migration, and the Office of Drug and Crime, which is not present in Rwanda, but supporting from Nairobi, working on people who inject drugs. So this is the totality of the UN support in Rwanda, and as UNAIDS, our role is to bring them together, to ensure there's harmonization of this work, and to coordinate and ensure the complementarity, but also providing the strategic information that will guide the planning and prioritization process. So this is how the UN comes together in Rwanda to support the Ministry of Health, but also at large the other ministries that are key on HIV program.
Yes. Thank you so much, Ms. Hindi. You just mentioned that we couldn't have been where we are without the civil society organization working at the community level. And I would also like to highlight that this was this year's theme, stressing enough how communities have been instrumental in facilitating collaboration with networks of key population to inform program guidelines for the most significantly affected communities, including organizations led by people living with HIV. I would like to ask you, Ms. Noliet, could you tell us how have the CSOs evolved in their role in the HIV response in Rwanda over the past 2 decades?
Thank you very much, the moderator. Happy World AIDS Day to you all. So she has really asked me a hard question, sharing what the CSOs has been doing for the last 2 decades. That's 20 years. We are here celebrating the lives that has been saved, and then the achievements that Rwanda has made. This is because of the civil society organizations and the communities. That's what I can mention, but to go deeper, civil society organizations has really done a lot of work in terms of community mobilization and making sure that they are providing support to key population, adolescent girls and young women. Most of the work they've been doing, it's about linking them to the health facilities to access HIV testing, HIV care, HIV treatment care support. And then beyond that, we know that in the HIV program, we have almost 30,000 plus female sex workers that are in the program. Beyond 15,000 men who have sex with men who are accessing HIV services. That's due to the efforts of civil society organizations and communities. Moving on forward, they have really invested a lot in awareness and education, where they've been providing education around HIV prevention, HIV care and treatment. For example, after educating after educating people who are at high risk or infected of HIV, and then linking them to the health facilities, they get to test and know their HIV status. Those who are tested positive, they are enrolled on treatment. And then those who are enrolled on treatment, they come back to the community. They have to do a follow-up, making sure that they are retained on treatment. And then CSOs also has been doing a lot of work in terms of capacity building. You mobilize communities, you link them to the health facilities for services, but that's due to the capacity building they've been providing through the peer education system that is already established among all the groups that are really affected or infected by HIV. And then also they contributed to the reduction of stigma and discrimination, faced by key population and again people living with HIV. Because we know that when those people are stigmatized and discriminated at the community level, this is one of the things that hinders them from accessing HIV testing, care, and treatment services. And then talking about the conducive environment, there is a lot that has been done by civil society and communities. For example, giving an example of decriminalization of female sex workers and MSM. It's been hard for them to access services due to the criminalization, but it's been a journey of around 10 years when CSOs engaged with the parliamentarians, different policymakers and lawmakers, making sure that the environment is so conducive for them to access services. This is an achievement we made in 2018 since 2009. And then moving on forward, also building partnerships and collaboration. It's been a great work done by CSOs because it has made them mobilize resources and make sure that they are learning from each other, accessing information, which has made them make sure that they are doing well their work at the community level. Lastly, it's about how some CSOs have really embraced the journey of using technology, where some of them are using the mobile phones in terms of making sure that the young people have access to information using digital platforms that are really more installed on phones. So those are the few things that I can mention on the achievements that CSOs and communities have contributed towards the HIV response.
Thank you so much, Ms. Doliet. That is quite remarkable. And with the community-led monitoring using data to inform your intervention strategies, I believe that we'll even go further to reach even beyond the targets that we have already. Thank you. Before I continue, I was informed that those who want to use the translator kits, for Kinyarwanda is line 1 and English is line 2. dukurikiyeho kumva Mrs. Sylvie ngatubwira uko byari byifashe mu gihe cya LP Plus yashingagwa mu 2003 mukanatubwira uko afite virusi itera sida bagize uruhare mu guhangana na sida mu Rwanda.
Murakoze cyane. Mu by'ukuri LP Plus ijya gushingwa muri 2003 hari ibibazo byinshi kandi bidukomereye. Cyambere hari akato n'ihezwa byadukorerwaga bikorerwa mu miryango yacu ndetse no mu baturanyi bacu. Ikindi kandi muri kiriya gihe twari tumerewe nabi cyane, dufite uburwayi bukomeye, turi mu bitaro. Bagenzi banjye barabyibuka, hari kwa muganga ahantu twitaga muri kane, twari twaraheze mu buriri muri makeya, tubona ko ubuzima bwacu bwarangiye. Muri kiriya gihe mbere y'uko urugaga rushingwa twarebye ku bibazo by'imfubyi. Twari dufite imfubyi za sida nyinshi, cyane cyane ko buri munsi hagendaga hapfa umuntu yishwe na sida. Ni muri urwo rwego rero tukimara kubona ibyo bibazo bihari, byabaye ngombwa ko bamwe muri twebwe twishyira hamwe kugira ngo dushinge urugaga nyarwanda rw'abafite virusi itera sida mu rwego rwo kwita ku bantu bacu, ndetse dushyiraho urubuga kugira ngo duhurireho, dushyiraho amashyirahamwe, amakoperative ndetse n'ama-ONG, ku buryo ubu ngubu kugeza ubu dufite amakoperative 500 ndetse n'amashyirahamwe 756 n'ama-ONG 13 n'imiryango nyarwanda itari ya leta 13. Ni muri urwo rwego rero twishyize hamwe kugira ngo tugaragazemo ibibazo byacu, tureba ibibazo dufite. Abana bacu kwiga byari ikibazo, biba birebire ku buryo byabaye ngombwa ko dukora ubuvugizi, dushyiraho ubuyobozi ku buryo dufite inzego hirya no hino duhagarariwe, kuva ku kagari kugera ku rwego rw'igihugu. Tugiye tugira inzego ziduhagarariye kugira ngo dushobore guhuriza hamwe gukemura ibibazo dufite twifatanyije na leta yacu. Muri kiriya gihe rero kandi ikindi kintu cyari gikomeye cyatubabazaga cyane, naho umubyeyi yabyaraga afite umwana, akabyara umwana akavukana virusi itera sida. Ibyo bintu biri mu bintu byatumye tuva hasi kugira ngo twegere leta idufashe dushobore kubona imiti, cyane cyane bamwe muri twebwe twasanze dufite virusi itera sida imiti itaraboneka. Byari ibintu bikomeye cyane, ariko leta yaduteze amatwi ituvana hasi iduhereza imiti. Ubu turafata imiti mu buryo bushimishije.
Urakoze cyane kudusangiza urugendo twaciyemo. Turashimira n'igihugu cyacu cyadufashije kugira ngo tuve aho hantu tugere aho tugeze ubu ngubu. Ndashaka kongera kubabaza nk'umuyobozi w'urugaga nyarwanda rw'abafite virusi itera sida, mwatubwira ibyo mwishimira mwagezeho kugeza uyu munsi.
Kugeza uyu munsi iburyo twishimira bwa mbere nuko twabibabwiye, natwe turagaragara ko turi abantu nk'abandi. Iyo habaye igihe cy'inama, natwe mu nzego z'ubuyobozi zisanzwe za leta, natwe turiyamamaza tutitaye ngo dufite virusi itera sida kandi tugatorwa. Ibyo byose biri kuduhesha agaciro. Ikindi kandi twishimira mu by'ukuri, tunasaba nyakubahwa minisita kutugerezaho umubyeyi wacu nyakubahwa perezida wa repubulika ndetse na first lady, iriya gahunda batugejejeho yo kugira ngo umwana ashobore kuvuka adafite virusi itera sida. Biriya bintu byaduhaye imbaraga nyinshi cyane, ku buryo muri iki gihe umubyeyi wese ukurikirana gahunda neza utwite, umwana avuka nta kibazo afite. Ibyo nabyo bitwongera iminsi yo kubaho. Ikindi dushimira twagezeho nuko kugeza ubu mu tugari, guhera mu kagari, mu bigo nderabuzima byose, guhera mu kagari dufite abantu twita abakangurambaga b'urungano cyangwa repair educators, bagenda basura abantu bafata imiti, babakangura gufata imiti neza. Ugasanga natwe ntabwo kubivuga birangora cyane, kuko ndimva nishimye kumva ndi imbere yanyu, nabyo byonyine biranyongera iminsi yo kubaho. Muri make twageze ku bintu byinshi bishimishije, kuko iyo turebye aho twavuye nge nkunda gutanga ubuhamya bwanjye nge mbere menya ko mfite virusi itera sida napimaga ibiro 20 mfite umusirikare umwe wonyine. Ibyo byose rero iyo mbibonye nkabona nanjye ndi umuyobozi mpagarariye abantu bangana kuriya, mba numva hari aho twava aho twageze. Murakoze cyane.
Urakoze cyane kongera kuduhereza no guhereza abarangaha message y'icyizere n'abari kudukurikirana hirya no hino ko ufashe imiti neza nta kintu utageraho. So up next, I will receive 2 questions from the audience for us to wrap up with the way forward messages. So 2 questions only, and then I don't see a hand raised. Oh, over there, please, yes.
Thank you. Thank you very much. My question. Thank you. I'm called Irawana Jean-Claude. I would like to ask my question to Dr. Corneille. And my question is, could you highlight some consideration or measures taken by the National HIV Program to ensure that all people living with HIV, or even those who are at high risk of HIV acquisition, can access all necessary prevention services as well as care and treatment services? Thank you.
We'll take the next one, and then we'll have the panelists respond to the questions. There is a hand raised. Can you pass them the microphone, please? Okay, while we wait, Dr. Kone, can you please address the question?
Thank you for the question. Access to prevention and also the treatment has changed over time, depending on availability and also affordability of tools using in testing and also in the treatment. But right now, the country has treat-all strategy, where if you diagnose everyone with HIV positive, you must put him or her on treatment and also monitor the treatment. On top of that, the country runs no discrimination policy. Everyone must be tested, regardless sexual, religious, and the other beliefs. You will find, because of some studies, etc., people from HIV division focusing on key population, sexual workers, because some studies are showing more infections among of them, so that if they diagnose and put on right treatment, they can also participate in prevention. And also, as the treatment policy has changed, recently we adopted some years ago differentiated service delivery model. Before it was 1 month package of drugs and pills, but within the SDM, you can put on him or her treatment for 3 months, 6 months, depending on how he's following up and also is adhering to right treatment. Thank you.
Thank you so much. We'll have the last question.
Yeah. Murakoze, nitwa Ingabire Sylvia, nkorera mu muryango witwa Dream Village. Ikibazo nshaka kubaza ndakibaza Mrs. Muneza. Ni izihe mbogamizi LLP Plus isanga zihari zikeneye kwitabwaho mu kurandura sida no kurwanya ubwandu bushya mu Rwanda? Murakoze.
Mbere murabibona inkunga zirimo ziragenda zigabanuka, tukaba twifuza ko rwose hakwiyongeraho abaterankunga bakwiyongera kugira ngo dushobore kugera kuri ya ntego twiyemeje. Ikindi kandi ni uko ikibazo cyo ku cyakato n'ihezwa icyakato cyane cyane mu rubyiruko kiri kugenda ntabwo kiri kugabanuka cyane kubera akato cyane cyane mu rubyiruko mu rwego rwo kubikirwa ibanga mu mashuri, mu miryango ndetse n'ahandi ku rubyiruko. Bidufashije ako kato nako kakavaho bya byiza kurushaho. Indi mbogamizi dufite twifuza ko leta yadufashaho ni ziriya ndwara zitandura zifata ku bantu bacu bakuze bafite virusi itera sida. Tugize amahirwe bakadufasha nk'uko badufashije, bakadufasha by'umwihariko abantu bacu bagira ubuzima burenze kurusha uko duhagaze.
Thank you so much. I think you've heard what she was saying, and I want to conclude from what she was saying as I want to hear a way forward from each and every one of you. How do we sustain the gains? How do we move forward? We've already reached the target, but I would like to hear from each and every one briefly, how do you think should sustain the gains? Thank you. Starting from you.
Thank you, Doctor. As way forward, we must sustain the achievement and milestones achieved. We have gone far 95-95, but we must achieve zero strategy, where we may register 0 deaths related to HIV/AIDS, 0 new infections. And to achieve this, we need to be innovative, because virus is adapting. It is bringing new mutations. So we need more tools in testing, more tools in treatment that can help us to achieve that target. And also, the global community is waiting for vaccine. Maybe more researches and innovations around development of vaccine and right tools can help us achieve eradication from elimination, and also the current response activities we are doing.
Thank you so much, Mrs. Hindi.
Thank you so much. I think for Rwanda, having achieved so much progress, it's now looking at the very last mile of achieving the goals of 2030. And always the last mile is the most difficult and the most expensive, in fact. So for me, one big area that we really need to look at is the area of financing the HIV response, because we're seeing that donors are reducing funding globally because of the global crisis that we're all going through, and they're decreasing their ODAs, they're decreasing their development assistance in general. So they're reprioritizing their funding to different countries. So we have to look at that. And also because Rwanda and other countries have achieved so much progress, donors are reallocating their resources to other countries where, they are much more needed. So we do have to look at domestic resource financing and mobilization. And for that, we have to see and look who is not in the discussion table right now. An example is the private sector. How can we mobilize the engagement of the private sector to generate resources for the response? For the last mile, I think also continuing to engage the communities to reach those difficult to reach populations, because what we've been doing in the past, for reaching thus far, will not necessarily be what we need to do to reach that last mile. So we need to engage, we need to go deeper into the communities and really mobilize those hidden population and get them to access the services. My last point is, at this stage of the HIV program in Rwanda, I think the engagement of the non-health sectors is increasingly important. I've mentioned earlier that this is already acknowledged, but we really need to take operational steps to make sure that other key sectors have the capacities in place to really be part of the HIV program. Because now we're looking at issues that affect inequalities in terms of access to services, education and information of girls and boys and young people and so on. So we really need to have those non-health sectors as part of the program, providing input and support to a multi-sectoral response.
Thank you so much. Please, Mrs. Ali.
I believe Hind read my talking points before I started, so maybe I can just augment a bit.
Yes.
As my colleague said, you know, funding resources are diminishing for HIV specifically. We collectively in this room, and as Hind mentioned, bringing in other institutions, Minikofin, Miniduk, Minelok, bringing them to the table in a real way to have conversations on where the response needs to go. You know, we've been in this fight for 20 years. What we needed in 2004 when PEPFAR came in may look differently today in 2023. And so how do we look at the data that we have, the systems that we have, what are the gaps that we need to close as we're looking to increase domestic resources and bringing more people to the table. And I think a good example of these conversations are the National Health Financing Dialogues that completed earlier this month. Those are really important, and taking action on those will be really critical for the next steps in the response. One thing PEPFAR has highlighted as we're looking at developing a sustainability roadmap with countries and partners is there's 3 keys that we see as to success: political, programmatic, and financial. And Rwanda is there politically and programmatically. We have a really strong political will in country. Our programs are incredibly strong. It's the financial component that's going to be the hardest task for us to tackle, and that's something that we will need to do together.
Thank you so much. Ms. Nuliet, let us hear from you. How do you achieve the last mile?
Thank you, Doctor. One of the things is that there is a need to invest in community-led response, because without communities, I don't think we can reach the last mile. One, in doing that, we need to make sure that CSOs are really having sustainable funding that helps them to continue implementing the HIV program. 2, it's about strengthening the peer education system, because we've seen that in the last 20 years, it has really worked well. So if we empower the peer educators and then they continue to do their work, this can take us to the last mile. 3 is about continuing to engaging the policymakers, because we still see the policies and laws that are not conducive for some key populations that are not yet reached, for example, people who use drugs. We need to make sure that policies and laws are providing conducive environment for them to access HIV services. Another thing is about strengthening the collaboration and partnerships with all partners, so that there is that strong collaboration in between there, where we can unlock funding, where we can learn from each other and then continue to deliver HIV services. Lastly is about making sure that we invest in community-led monitoring. Currently, we talk about evidence-based decisions. How do we make sure that CSOs are invested in terms of collecting data? And then how is that data being quality? And then how is it used by CSOs and communities when they are advocating to improve in programming or in changing the policies? And then lastly, it's about investing in research, because we've been seeing the national level conducting researches, but also communities and CSOs can do that. How do we make sure that they are invested in, they are doing research and collecting evidences, so that the findings can support the programs on where to improve and invest where there are still issues. As I conclude, we've been discussing pandemic preparedness. How do we make sure, if tomorrow there is a pandemic, that CSOs and communities continue to deliver services to their peers? How do we make sure they are part of the pandemic preparedness programs? And then the last one is about, Ali is telling me there is a lot of the last. And then how do we make sure that part of that, we are creating a space for learning and experience sharing, because that matters, so that we can do South-South learning. Thank you.
Well, thank you so much. Please, a big round of applause for my panelists. This was an interesting discussion, and I believe that as our take-home message, we have to think about the sustainability of our gains. Each and everyone here who are in the health sector, we think about the sustainability of our gains mostly at the health financing level, since we have the political and programmatic right behind us in achieving the last mile. Thank you so much for your kind attention. Thank you, the panelists. You may just go back to your seats. Thank you.
Barakoze cyane abari bari muri kino kiganiro, turabashimiye ku biganiro byiza bagize. By'umwihariko Minisiteri y'Ubuzima bagaragaje ko yakoze byinshi mu guhangana na virusi itera sida, cyane cyane kwegereza imiti irwanya ubukana bwayo no kwita ku babana na virusi itera sida, ndetse no gukomeza ingamba zo kwigisha abaturarwanda inyigisho zo kurwanya sida. Hanyuma kandi no gukangurira abantu kwipimisha ngo bamenye uko ubuzima bwabo buhagaze. Hanyuma PEPFAR by'umwihariko mu Rwanda yatangiye mu mwaka wa 2004, yakoze byinshi ku nkunga y'ibiro bya Perezida wa Leta Zunze Ubumwe za Amerika. Ashimiye uburyo igihugu cyacu gikoresha inkunga za PEPFAR mu bikorwa byo kurwanya sida. Hanyuma kandi abari bari mu kiganiro bagaragaje ingamba zitandukanye zo gukomeza kurwanya sida no gufatanya n'inzego zitandukanye hashakwa ubuvuzi burambye bwa virusi itera sida, ndetse kandi hari ingamba zo gukomeza kwegereza imiti kuri buri wese ugize igihe cyo kuyifata. Hanyuma hakaba no gukomeza kwigisha abantu muri rusange kwirinda virusi itera sida. Hari kandi no kwigisha abantu bagize igihe cyo gufata imiti gukomeza kuyifata neza. Hanyuma banasoje kandi bavuga ku ngamba zo gukomeza gukora ubushakashatsi, cyane cyane mu gufasha kugira ngo haboneke imibare itandukanye yazafasha mu gufata mu ngamba z'igihe kizaza mu gukomeza kurwanya n'ubundi nyine virusi itera sida.
Arakoze cyane Moise. Kuri agenda yacu y'uyu munsi igikurikiraho ni umukino nyigisho, umukino witwa Ideal World. Ni umukino wigisha kuri virusi itera sida mu rwego rwo kuzamura imyumvire yacu twese. Turabizi ko nubwo tuba twizihiza umunsi nk'uyu, tuba tugomba kugira isomo dutahana. Urerekana ko ari ngombwa kwiga kugira ubumenyi, nk'uko tuzi ko kumenya ubumenyi twabugira mu mibare bidufasha twese. Ikindi, uyu mukino urerekana ingaruka za virusi itera sida, ndetse ukerekana n'uruhare rw'urubyiruko, njyewe nawe, mu kurwanya virusi itera sida, ndetse no gushimira abakora mu nzego z'ubuzima badufasha umunsi ku munsi. Ubutumwa bw'uyu mukino muri rusange ivuga ngo twese hamwe twubake ahazaza hazira virusi itera sida. Ladies and gentlemen, next on our agenda, we'll have a poetic drama by Malaika Uwamahoro team. Let's welcome them on stage with a round of applause. Thank you.
Children, we want an ideal world free from pain and all other burden. We want an ideal world. We want an ideal world.
Too many diseases, but we are the medicine. The future is bright, I cannot be a pessimist. We gotta take the right measures, so we don't gotta check the measurements. Don't look at it as an embarrassment, look at it as betterment. For society to make you a better man, want a woman to feel the empowerment.
In an ideal world, tell me what you've heard. Where HIV doesn't mean you don't see me. The drugs, the dose and frequency means healing requires consistency. Our people are living fulfilling lives visibly, where our so bright. I tell you, it's blinding. Health workers have learned to push and strive. Our communities have learned to push and drive. Education and awareness. By having AIDS, you're not anywhere less.
Isi y'urukundo isizira guheza aho uvuga ukumva wasaba ugahabwa isi y'urukundo wataba ugatabarwa n'isi ijwire isi y'inzozi zanjye.
In an ideal, how do I feel? What do I see? Who do I be? If the unseen can be now sung, we stay equal to none. And if we stay strong, we stay chosen and one. Since 1981, 40.4 million people have died. R.I.P. We are still fighting.
In 2022, 39 million people were recorded living with
HIV/AIDS. Virusi itera SIDA.
HIV and AIDS.
Muri miliyoni 39 z'abanduye virusi itera SIDA,
37.5 million are 15 years and older.
And 1.5 million of those are 14 years and younger. We are still fighting.
53% are women and girls.
3,100 out of 4,000 adolescent girls and women aged 15 and 24 become infected.
We are still fighting. We are still fighting.
We are still fighting.
turacyarwana.
We are still fighting.
The staggering stats let me know we're still under attack. Show me percentages that break my soul. Show me that we have not yet gained control over the situation. Our city's saturated in an AIDS pandemic escalation, leaving our youth in devastation. They do not know enough, and there is not enough attention where it counts, where it amounts. Globally, 46% of all new HIV infections were among women and girls right here at home in sub-Saharan Africa. Women and girls, girls and women. But for your understanding, our mothers, sisters, and daughters are being infected. This is personal. It is all our fight.
They saying change is coming, I just keep on asking them when. Do our young girls feel safe in a room full of men? Do our young boys get to talk about the pain that's within? We all need therapy. Take your mental health like a newborn baby and treat it carefully. Too much pain in this world, way too much evil. Diseases creeping up and killing all our people. Give aid to the people with AIDS, we all equal. We can't stigmatize all the people in our lives. Spread awareness, we all gotta be allies. Tell our youth to use protection, we gotta be safe. It's a sensitive topic, but we gotta be brave. And that's just how I see it. Your best friend or your cousin could have HIV. Get educated, it's not being promoted on TV or IG. We should use our social medias wisely. Better to be safe right now, the consequences are pricey.
But here we all are, we let the pendulum swing. A pandemic that moves so rapid, the impact hurt the homes within. Inspired to change the algorithm of this statistic, eroding at a future we are trying to stick with, grasping at grass and holding our route we choose to anchor in solution. Ridding our society of this dark cloud. Your stigma is a lack of education. Don't let your ignorance be so loud. We commemorate the strength it has taken to remain unshaken, because every voice matters, and if you stay silent, it shatters.
Dusingira ibyiza byinshi nawe dusiga inyuma.
Youth, it's time for you to know the truth. We're healing old wounds, so this can be old news and a testament to what we can do when we come together. So hear my battle cry and unite to fight. to health workers, gratitude. Your work speaks in magnitude. You give us hope to take control, to reach for a future we can hold, reminding us all to stay bold. Together we can fight the virus, fight the cold. Fueled with fire, we are consoled. Fighting every battle means winning every war. Wielding my spear and using my shield, I'll be on the front line in the battlefield. An AIDS-free future is in sight. Hear my battle cry, unite and fight.
It start with you and me, things that can ruin you can also ruin me. Community, unity, you gotta do some things they don't do usually. Spreading awareness, your health is your wealth, and that's the true currency. Currently having a health emergency, we need some urgency. The health workers helping, and we gotta think of it. Start with yourself and reflect and get checked for the sake of our people. Just stand up, we need you to fight all the evil. Diseases are lethal. We've seen it before, we can't have a sequel. 95, 100 reasons to stay alive. This generation can make a real change. We just gotta strategize. We just gotta analyze. We cannot stigmatize. A change can be made. We don't have to fantasize.
What is at the heart? I think every health worker knows how to implement art. Art stands for antiretroviral therapy and all recreating trust, and ancient rivers turn. When we choose to learn how to recover as a community, art has the ability to advocate for inclusive social and economic development. We move heavy like the great elephant, thus ready to lift our youth. But we have to be willing to embrace the truth. Don't just theoretically stand the test of time. Test in time. You, me, us, they, them, she, he, her, and him. We draw from the same inclusive spirit and win. So how do we honor the agents who work within? The pillar of our society and implementing partners. Our warriors living with HIV/AIDS who raise the shield in awareness. You stand strong, magnified and seen. Seen, magnified and strong.
Make a deal, we can't sit still. I watch your brothers and sisters with HIV in their system and not a system. They gotta know that we with them. Don't be a witness, use your wisdom. You and I, just us, let's change it. We could be the ones to change a generation with a little more education and a little patience. The problems we'll face them. We are the kids from Kigali, the land of 1,000. We not afraid and we're climbing the mountain. Can't leave our people the same way we found them. We got a voice and we're screaming the loudest.
Let's make a deal. Let's make a deal. Sign and seal, sign and seal. It seems it's let's make a deal. Sign and seal, we're living in our dreams. Let's make a deal. Sign and seal, it seems it's let's make a deal. Sign and seal. Let's go.
reka tubongere amashyi menshi cyane. Mu kinyarwanda baravuga ngo aho abagabo babiri basezeraniye niho bahurira. Basoje batubwira, let's make a deal signed and sealed. Thank you so much, Malaika team. Nta byinshi ndi burenzeho nk'uko batumiye, twavuze ko ari umukino nyigisho, nubwo hari aho bavugaga mu ndimi z'amahanga, ariko nizeye neza ko hari icyo twakuyemo, ari nayo mpamvu tugira tuti aho abagabo basezeraniye niho bahurira. Twese twiyemeje kurwanya virusi itera sida, nk'uko mwabibonye hano bakoze uruziga barwanya sida kandi barayishobora. Bivuze ngo twese dushyize hamwe twabishobora. Reka tubongere amashyi. Ladies and gentlemen, next on our agenda, we'll welcome Mr. Ozonia Ojielo, who is the UN Resident Coordinator, for his remarks for today. You're welcome.
Wow. Malaika team, you deserve another applause. Thank you. Nyakubawa, Honorable Minister of Health, honorable members of Parliament who are present here, senior government officials present, both from the civil service but also from the security agencies, representatives of the diplomatic corps and colleagues in our development partner community, my dear colleagues in our one UN family, representatives from civil society, private sector, media. I see representatives of faith community present here, as well as community-based organizations, distinguished partners, ladies and gentlemen. Good afternoon. I'm deeply honored to speak here on behalf of the One UN family as we commemorate World AIDS Day. And I can only start my remarks by repeating what some members of the panel have already said, to congratulate the government for the tremendous success that's been achieved in reaching the 2025 targets ahead of time. And yes, and we know that our civil society partners and the communities are the ones in the front line of the response, but we need to acknowledge that this is an incredible achievement. And when I look at the list of partners here, I cannot mention all the names, but when we talk about the success that's been attained, it's also because of the significant investments that all the partners listed here and some that are not listed have contributed to this effort. So Rwanda is showing Africa and the world that the path to end AIDS as a public health threat is possible, that HIV is preventable, and that everyone who needs HIV treatment should be able to get it, and that no one should die from AIDS. I would also like to appreciate Rwanda's high-level commitment to end AIDS by 2030. Government leadership and the active engagement of civil society driving the change and influencing policy decisions have made it clear that this aspiration is realizable. The result is that over the last 14 years, Rwanda has been able to bring down new HIV infections by 70%. This indeed is remarkable. We heard earlier from the panel how HIV community-led organizations have had a central role to play in this success. We are, as a United Nations family, very much impressed by how these community-led organizations were key in ensuring that during the COVID-19 pandemic, the most at-risk and vulnerable communities were supported to ensure that their life-saving medication supply is not disrupted and that they had access to food, to secure their medication and other basic needs. Those community-led organizations will remain critical to achieving that last mile to find any hidden populations, to ensure that they exercise their rights of access to equitable and quality health services without stigma and discrimination. Yakubawa Minister, we know that you are an HIV champion, and we know that you have a vision of an AIDS-free generation. Thank you for your work and your leadership. We are very confident that we will see this vision come to pass very soon. There is no vaccine for HIV, but with government commitment to allocate resources, a focus on a human-centered approach, an enabling policy environment, and an inclusion agenda such as we have in Rwanda, it is possible to have an AIDS-free generation so that we can share the lessons, as we're already doing, with the rest of the world. Yakubawa Minister, I know that you are leading on the National Health Financing Dialogue under the overall leadership of His Excellency the President, who is championing domestic resource mobilization for health in Africa. So we want to applaud your leadership, but that of His Excellency the President for that as well. This is definitely a step in the right direction for health security in Rwanda. The dialogue on sustaining the HIV response is certainly part and parcel of that to sustain the gains made so that we can achieve the last mile, and it helps in contributing to that as well. Honorable Minister, ladies and gentlemen, AIDS is not over, and HIV continues to remain a threat. So if you allow me, I would like to make a call to action for all of us to end AIDS as a public health threat, as Rwanda has committed to do by 2030. And I'd like to cite a number of factors in that regard. That AIDS is not just a health issue. It requires a multi-sectoral approach that also engages non-health actors. A whole-of-government approach, a whole-of-society approach is critical for us to end AIDS. It's great that in this response, civil society and communities are leading. We know, as my colleague, the country director for UNAIDS has said, that the last mile is always the hardest. It is the most challenging. Therefore, we need to join hands, but we also need to pool our resources. And so the theme for today's World AIDS Day speaks to this fact directly. We need to continue to scale up quality HIV-related services and ensure accessibility for everyone, especially key populations that are most vulnerable to HIV. And I want to commend all the various groups, the civil society partners that are working with different population segments. We had statistics of the degree of coverage of all those population segments, so we congratulate you for the excellent work you are doing. Perhaps we also need to take a further review of our laws, our policies, and our practices to ensure that we have a full inclusion agenda. But we heard the panelists talk about stigma and discrimination faced by people living with HIV, as well as by key and vulnerable populations. So is there anything else that we can do in terms of our policies, in terms of our regulations, to ensure that we address the stigma and discrimination that they face, to ensure that no one is left behind? I see the great engagement with youths, especially girls, to inform the HIV program and to ensure that their needs and priorities are addressed. So it does mean we just need to continue to scale up on that. We see the statistics for Eastern and Southern Africa, that 63% of new infections are among young girls. In Rwanda, girls are almost 3 times more affected by HIV than boys. So we need to collectively address this triple threat of HIV, GBV, and teenage pregnancy faced by women and girls. Financial sustainability is also important to sustain the gains made so far and to scale up the program. And many of the panelists also spoke to that. So increasing partnerships, as they have talked about, to increase allocation of domestic resources for HIV, become necessary. And I think that some colleagues have already highlighted the need for us to deepen our engagement with the private sector. So that's the next frontier for our work. Honorable Minister, distinguished partners, ladies and gentlemen, I want to reiterate the support of the One UN Rwanda family to the government and the communities to reach that finish line and to end AIDS by 2030. So it's not just the UN agencies you see listed here. There are also many UN agencies not listed that are present in this room as a demonstration of the support and the commitment to the government on this issue. 2 weeks ago, our One UN Rwanda joint team on AIDS, under the leadership of UNAIDS, finalized their plan of action for the next 2 years. The discussion was actually guided by RBC to outline the priorities of government, but to define the critical gaps so that the required technical and financial support for 2024-2025 can be mobilized and working in concert with community-led organizations. I will say that this is clearly the best example of joint planning, but also cooperation across the UN, but with government and partners. And the fact that we have listed the multiple partners here, the testimony we have heard from the partners demonstrate that no one institution can do it alone. Some may be strong in the financing. Some may be strong in the mobilization, in providing resources. Some are strong in advocacy. Some are strong in legislative instruments. It is the joining up of the efforts that make all of this possible. And so as a United Nations system, we want to commit to remaining a strategic partner with the government and all stakeholders to ensure that Rwanda stays on track to end AIDS as a public health threat by 2030. Allow me to please share with you some of the key cooperation elements between us as a UN family, the government, and stakeholders in the response to HIV, which includes our work together in humanitarian settings, and which we hope to achieve over the coming 2 years. And this will contribute directly to 10 of the Sustainable Development Goals. Many have highlighted, as the minister and many of us worked at the exhibition hall, the question of economic empowerment, the question of social protection for at-risk groups becomes important. But also the relevance of an integrated approach, integrated systems to deliver nutritional support and HIV services. The question of access to equitable and quality health services, particularly for the at-risk populations and vulnerable communities, and the power of education and well-being, including comprehensive knowledge about HIV to help prevent infections. And we do know that issues around human rights, reduced inequalities, gender equality, including discrimination, SGBV, and harmful practices are part of the effort that when we address them, it cuts across multiple SDGs. And as the chairperson of the RRP talked about, the question of safe and secure work environment, that these are healthy people, they are part of our society, they are entitled to decent work and to fulfill their own potentials as members of our society. And then finally, of course, issues around local AIDS responses by the city, by community groups, but ensuring access to justice and people-centered accountability mechanisms. There are many platforms of engagement. I don't need to repeat all of them. All I do need to say is that there is a marked difference when we celebrated World AIDS Day last year in Huye and today. And so for each and every one of you present here today, I salute you. For each and every one of you who has contributed to this unique effort that we have made, we salute you. If we have not mentioned your name or that of your organization, we want you to know that you matter, you count, don't stop. Murakoze cyane.
Tumwongere amashyi ku butumwa bwiza tugejejeho, cyane ko agaragaje ko igihugu cyacu cyashyize imbaraga nyinshi cyane mu kurwanya SIDA, kandi ko afite icyizere ko bitarenze umwaka 2030 nk'uko twabyiyemeje tuzaba twahagaritse ubwandu bushya. Duhe amashyi menshi nyakubahwa Minisitiri w'Ubuzima. Hanyuma kandi dutege amatwi ku mpanuro n'ubutumwa bwiza agiye kutugezaho nyakubahwa Minisitiri w'Ubuzima.
Mwiriwe neza, muraho. RC coordinator, Mr. Zonia, PEFA coordinator, Ali, EN heads of agencies, deputy IGP leaders, LP Plus chairperson, ndetse n'abagize LP Plus mwese, n'ababonye benshi. So we're here today to celebrate the World AIDS Day once again. And I was looking at the data and something kept my attention. It's exactly 40 years since the first case of AIDS was reported here in Rwanda, 1983. And we have already 40 million people living with AIDS in the world. Almost. And there are 40 million people who passed away because of HIV and AIDS. And this 40 things was always ringing when discussions was going on. And the different demonstrations we had, actually the last one here, was quite interesting. So I wished I could join and dance, but I think this is another level. Thank you for all organizers of this event. When we meet here again, we reflect, we commit, we support, we care, and we move on as this pandemic, like other pandemics, are not yet gone. We are still fighting. So HIV is not yet finished. We still have those millions I mentioned living with HIV. And there are others who are dying from AIDS as we speak. And unfortunately, there are young people who are getting infected as we speak. Again, looking at the report from RBC and partners here, young people, young generations, is now more at risk than ever before. In terms of infections, new infections, they represent almost a third of all new infections in Rwanda, and in other countries it's not a different situation. And also when they get tested and treated, the compliance to treatment among young people is the lowest compared to other age categories, which means it's another step towards treatment resistance, new mutations, and probably complications to further treatments. We are moving towards first line, second line, third line, probably no line of treatment at all. We looked at the exhibitions this afternoon, what is being done. But some questions were raising that, are we doing enough, especially to young people? And the answer, I think, is no. We're not doing enough to protect young people. So here today, we should also look back on our strategies. How can we, in the next 1 year, before we meet again for another World AIDS Day, change, adapt, adjust, and even invent new ways of protecting young people? Because they're at risk, and this is the next, the generation of next leaders, next resident coordinators, next doctors, next ministers, and so on and so forth. They need to live free from HIV, or even if they get it, get better treatment, get to U equals U, undetectable, untransmittable. We've seen that. And then this is a sign of hope that we need to tell young people, and also those who are not yet, who are not young could be older, but age is just a number. We know that life expectancy is increasing. Let me talk about the other side of the journey, which is people are living longer with HIV, with AIDS, with HIV, but we're seeing more diseases and more complications we've never seen before. And Sylvie has outlined that as a request to us. The government of Rwanda has been investing and working with different partners to make sure we get antiretroviral treatment. And now we're seeing people who have lived with HIV longer are getting, like anyone else who is aging, some diseases of age can come, and these are non-communicable diseases. So in one of the booths, we've seen treatment for non-communicable diseases, and we should integrate NCD's screening and treatment actively and expand that into our HIV management so that we don't protect people on one disease and we lose them on another disease. So that is the comprehensiveness of the treatment that we are talking about. That is the integration of our programs we are talking about. So being on treatment for 20 years or 40 years is not an easy thing. At the beginning, Sylvie mentioned room 4, or salle 4 at CHK. Some doctors here you can see in the room, they remember. That time, at the beginning of our treatment, you're receiving as many as 32 tablets of antiretrovirals a day. 32 tablets of antiretrovirals a day at the beginning of scale-up of treatment. So we moved from that to 5, now to 1. 1 tablet, 1 pill a day. So we are missing one piece into this puzzle, or another progress, because 1 pill has been there for so long. That's why we need to think of what else. After 1 pill a day, we should think of 1 injection for several months. And I understand that it is not just a dream, it's coming. So we would like to encourage everyone who is working around this planning that this progress, evidence-based implementation should continue, that we prevent, we treat, but also we innovate with newer ways of treating, 1 injection for some months, or twice injection across 1 year, maybe 1 injection in January, another injection in June or in July. This is where the science is taking us. This is another sign of hope. This is another sign of hope for people who have been on treatment for so long, so that we don't get the level of fatigue. And again, it's another way of telling people who are living with HIV, who have been taking treatment consistently, to remain on treatment, on daily pills, until this injection or this newer or easier way of getting treatment is coming. So it's a homework for us as leaders, as program managers, as partners, as funders, to make sure this is happening quickly, because we've seen a transformation from the time was no hope, people were just getting infected and losing hope to life. So today, we're seeing that you can live with HIV, live longer, raise your family, have children, grandchildren, and contribute economically to your country. This is what we wish to see, we continue to see. And this is what World AIDS Day means. It means that we are committed, we are working together, we are evidence-based, and we don't just commit, we execute, we implement, and we keep moving forward. So to conclude, I would like to thank everyone who has been working to make HIV not a death sentence, but a hope for life, to make HIV not a single disease, a vertical program management, but a health system strengthening, to make sure that we support each other as a community, as communities, as countries, and until we end AIDS, we are not going to stop. Thank you very much. Have a great day.
Arakoze cyane Minisitiri w'Ubuzima nyakubahwa ubutumwa mutugejejeho. Twizeye ko burimo impanuro nyinshi kandi nziza, kandi buratanga icyizere cy'ubuzima cyane cyane ku bamaze kwandura virusi itera sida no gufata ingamba ku batari bayandura.
Thank you so much, Honorable Minister, for your remarkable remarks for today. Next on our agenda, we are going to have a celebration, a moment of celebration. We are going to give awards to health centers who have achieved the indicators that we report on a monthly basis in the system at the central level. These indicators are viral load suppression, prevention of mother-to-child transmission, lost to follow-up, and index testing.
Umwanya rero ukurikiyeho tugiye guha umwanya ukurikiyeho hagiye gutangwa ibimenyetso by'ishimwe ku nzego z'ubuzima zitwaye neza mu byiciro bitandukanye. Icya mbere hari abagabanyije virusi mu maraso ku rugero zitagaragara, hari kandi azahize izindi mu kugira abana bavutse badafite virusi itera sida bakavuka ku babyeyi bafite virusi itera sida. Hanyuma kandi hari n'abafite bafataga imiti kandi bagakomeza kuyifata neza batayicikirije. Hanyuma hari kandi n'ibigo by'ubuzima bifite umubare munini w'abantu baje kubyipimishaho. Niwo mwanya ugiye gukurikiraho. Ibimenyetso by'amashimwe biri hariya, ababifite bakwigira hafi.
We'll call upon Honorable Minister to hand these awards to the representative of these health facilities. Outside them, we have Kabusunzu Health Center, that represents from the province of Kigali.
Uhagarariye ikigo nderabuzima cya Kabusunzu yakwigira imbere.
Muraba muhagaze hano turaza gufata ifoto y'urwibutso. Dufite kandi ikigo nderabuzima cya Kibungo gihagarariye intara y'Iburasirazuba. representative of Kibungo Health Center that represents the Eastern Province. A round of applause. Dufite uhagarariye ikigo nderabuzima cya Kayove yo mu ntara y'Iburengerazuba. Kayove Health Center from the Western Province. Tumuha amashyi mu gihe ari kuza. Nyamagabe Health Center representing the Southern Province. Ikigo nderabuzima cya Nyamagabe mu ntara y'Amajyepfo. Reka tumuhe amashyi mu gihe ari kuza. Nyamagabe Health Center from the Southern Province. A round of applause. Muhoza Health Center from the Northern Province. Ikigo nderabuzima cya Muhoza mu ntara y'Amajyaruguru. Reka tumuhe amashyi mu gihe yegera imbere. Muhoza Health Center from the Northern Province. Nyuma turasaba abahawe ibihembo kwegera nyakubahwa Minisitiri w'Ubuzima kugira ngo dufate ifoto y'urwibutso. Reka tubongere amashyi. Kandi twese duharanire ko n'ubutaha natwe tuzaba mu bari guhabwa ibihembo. Thank you so much. Next, we are going to have a group photo that will be in two different groups. First, we'll call upon the middle row to join Honorable Minister at the stage for a group photo. And second, we'll have the first row to join on the stage. Mu gihe bari kwegera imbere, team ya protocol igiye kudufasha gufata bya bikoresho byadufashije gukurikirana ibiganiro byari mu ndimi zitandukanye. Murakoze.
Abayobozi b'ibigo nderabuzima mwafata ifoto vuba. Okay.
As we still have our guests on stage, we'll call upon the whole first row to join us on stage for a group photo. Abashinzwe gufata aya mafoto baradufasha ku buryo buri wese agaragara.
Ibirori byaberaga ahangaha muri Kigali Convention Center byagaruvugaga ku munsi mpuzamahanga wo kurwanya SIDA birarangiye, aho rero hatanzwe imirongo itandukanye y'ibisabwa byazakorwa kugira ngo byibura mu 2030 mu Rwanda habe hataraboneka ubwandu bushya no kongera inkunga ijya mu bikorwa byo kurwanya virusi itera SIDA. Ikindi nuko mu mwaka utaha hashobora kuzaboneka uburyo bushya bwo gufata imiti. Mukomeze kunogerwa na gahunda zitandukanye za RBA.
RBA app is here. How to get it?